Hey, hello everyone. Welcome to Blumber Healthcare podcast again, where we explore the journeys and insights of healthcare professionals who have been shaping the medical ecosystem from within the system. Right. Today we have with us Dr. Krishna Mohan, a urologist and an andrologist, specializing in men's health and urological conditions. Right. An area that is often overlooked but deeply impact the quality of life we have. Coming from a family of doctors himself, with his father being a radiologist, his journey into Medicare began quite early, I believe, and naturally evolved into a passion for surgery during his MBBS days. So he went on to pursue his MS in general surgery from Madras Medical College, and later he has specialized in urology with a further focus in andrology, an emerging and much needed um, field, I suppose. Alongside his critical practices that he does, he is practicing at PSG as one of the contributors there, the PSG Medical Hospital, and he has his own clinic. Along with that, Dr. Krishna Mohan is also actively involved in bridging the gap of awareness that is there in men's health today through social media platforms. He has been posting on YouTube, Instagram, and such other platforms where he gives out a lot of knowledge about men's health and what is important and how to take care of it. Today, we'll explore his journey, his work in urology and andrology, and why he chose this, and certain awareness that might be important for men in general. And okay, Dr. Krishna Mohan, welcome to the podcast. How are you doing today, Doctor?
Yeah, I'm doing fine. Thank you for having me, and a wonderful introduction. You have covered almost everything about me. In short, yeah.
That's nice. So, Doctor, let's start now. With this, let's start with your journey itself, right? How did you start? Why did you you grew up in a family of doctors, and what
Yeah.
made you take up the decision of becoming coming into Medicare or becoming a doctor yourself?
So my journey, see, my father was a radiologist, and he was a very famous radiologist in our city. So he used to be very busy all throughout the day, and I used to watch him do see his work. So the thing is, the most important point that my dad inculcated in me was the dedication and the thought of making the patients free of their diseases. So that single point made me want to pursue medicine. So we used to see a lot of diseases, patients being affected by severe diseases. And once my father diagnoses it using scans, and the treating doctor would treat the patients and cure them of the diseases. So, and as I grew up, as I came to the end of my schooling, maybe at 12th standard, so I had the dilemma of choosing whether to take up as any other Indian school children. I had the dilemma whether to choose engineering or medicine. So I had good scores in both. In fact, my engineering cutoff was better than my medicine cutoff. So yeah. So but the thing is, the passion within me to pursue medicine, and so I had my MBBS. I joined MBBS in PSG Medical College, so which was in my hometown itself, Coimbatore. And as I was going through my medical initial undergrad, so I had a liking for surgery. So because surgeons had the privilege of operating on patients and then completely curing. Say if the patient had a tumor, you can completely remove the tumor and the patient would be completely cured of cancer. So that intrigued me. So so surgeons have the power to cure anything. So you can remove tumors, cure cancers, and all those things. So that actually I felt that they were playing God. Like, they could do something which normal humans could not do. So that inspired me. and also my professors were very talented people. They used to do all sorts of surgeries, and that also with a lot of confidence, and the patients also should used to be so grateful to the surgeons. And so that intrigued me, and I wanted to pursue surgery. So the pathway in India is, when once you want to pursue surgery, the first step would be joining a post graduation in general surgery.
Okay.
So I joined general surgery in Madras Medical College, and those 3 years were very useful. So my professors, and especially Dr. Muthukumaran, there was a professor called Muthukumaran. He was my chief, and he was very supportive to his postgraduates. He used to teach so much, both in academics and also the surgeries individually. So that also helped me to grow as a surgeon. And in Madras Medical College, the caseload was very huge. So we used to get to operate on varied sorts of diseases. And also we used to treat it, because it was a government medical college, we used to treat all the poor and downtrodden people as well. So that also created a sense of what to say, more it was more helpful for me. And also I also felt good that I was helping the lower cadre of people as well. So, and then the thing is, I started when I came to the end of my post graduation, I had the similar dilemma would be there, which super specialty to choose, because I wanted to specialize and get to the top of the pyramid. So I wanted to get whatever maximum specialization I could do, whatever topmost degree I could get in the country, I wanted to get. So the super specialty would be the final this thing. So the dilemma arose whether to take gastro surgery to operate on the abdomen, or whether to take urology, and whether to take neurosurgery or cardiothoracic surgery or onco surgery, which is cancer surgery. So the and also plastic surgery. So the options were very wide. Yeah. So I wanted to, I always liked urology, because in urology you could super specialize to andrology, because andrology is a field that is very in the initial stages in India when I wanted to pursue urology. So the andrology, I always felt that women had an upper hand in healthcare. So always, because they had different points of approaching healthcare. Initially, when they attain puberty, they usually get a checkup, and the next, when they enter into wedlock, also they do have a checkup. After that, when they get pregnant, they have a checkup. So a lot of points when they have approach to the healthcare system. But unlike males, only when they get sick they approach the system. So that is the huge difference between women's healthcare as well as the men's healthcare in India. So I was very intrigued about andrology, because I wanted to do something in andrology. So urology was the solution for it, and also I liked urology because it was more of minimally invasive, so endoscopic, robotic, and all the newer sets of gadgets were coming into urology rather than other fields. The first initial robotics also came through urology only, because the pelvic organs, when we operate, they're easier to operate, especially the prostate, easier to operate using robotics. So that is when I joined urology in Amrita Medical College, and that was the only hospital which had a Da Vinci robo, and in the super specialization when you are in a teaching hospital. So I joined there, and the 3 years were very useful, and the interest in andrology is even more increased. So after that, after completing my urology, I just wanted to focus on andrology and also doing urology, general urology cases side by side as well.
Okay.
Yeah.
So after urology, when you took up andrology, that took at least 3 years more, or it's
No, the thing is, andrology was there was no structured fellowship in andrology
in India.
as of such in India.
Okay.
So what I wanted to do was just do an observership in andrology.
Okay.
So a few days with some experts, so that I could learn, because in your super specialty itself, you would be learning a lot about andrology itself.
Okay.
So I wanted to brush up my skills in andrology.
Okay.
So I would do brief periods with eminent andrologists in India, and then learn the skills, and then I started practicing andrology and also doing general urology side by side as well. Yeah.
That's nice. Interesting journey, doctor. So, so from what I understood, the reason why you became a doctor was essentially because you felt the part that your father or the other doctors had, where they could cure people, and the people or the patients who came to them were happily going back home, and they would actually thank your parents, thank your father and the fellow doctors, and that kind of inspired you into picking up MBBS as a profession when you were, and then continuing to become a surgeon also, right? So this urology, andrology and surgery, are they you still have to conduct surgeries, or it's kind of sideline? How is it?
No, the thing is, andrology is a surgical specialty.
Oh, okay.
So so we do surgeries to improve fertility. So we do sperm retrievals directly from the testis. We do surgeries to retrieve sperms, and also we do penile implants for erectile dysfunction. We do prostate surgeries for prostate removals, and for cancers, prostate cancers, we do robotic surgeries, and also that includes so, and also for urology we do this thing when the urinary tract in males is blocked by strictures or any other diseases, we do operate on them. So it's generally a surgical specialty.
Okay.
And maybe you can say 50% of OPD and prescribing medical therapy, and 50% would be surgical.
Understood.
It's a good balance of both.
Okay. So that's nice to understand. So when you are speaking about urology, see, people like me, we don't know anything about urology and andrology. Let's say we are discussing for general public like myself, right? So what kind of conditions or common identifications that can be when a person is suffering with some urological conditions, something like that? Is it visible, or is it something that they can approach? They can identify.
Urology, correct. So urology, generally, let's come from the common ones. So kidney stones. So kidney stones are the most common.
Okay.
So kidney stones, the symptoms can be pain in the flanks, abdominal pain.
Okay.
Whether urine output can decrease, or there can be blood in the urine, or there can be any fever because the stones are infected or the urine is infected due to the urinary blockade. So these can be symptoms in stones. And generally, and also prostate is very common in males. So prostatic symptoms would be whether the urine, they're finding it difficult to pass urine, or their frequency urine is there, or they pass urgently urine and it becomes an embarrassment, or the flow of urine comes down. In this also blood can happen in the urine. And other common things are urinary strictures. So blockade in the urinary passage can happen, and that has to be relieved. That also has similar symptoms. So mostly the symptoms would revolve around difficulty to pass urine or decreased urine or any urinary blood, fever, and infections related to that. So that is the most common symptoms. In andrology, maybe when the couple has been married for 1 year, and they don't have children, they can approach an andrologist for evaluation. So that is one. And sexual problems, like if they don't get aroused or their libido is very low testosterone symptoms like fatigue, decreased fatigue, and decreased interest in work, or decreased muscle mass, they become very thin and obese, or they become very obese. So extremes can happen. So that also hormonal issues can happen in males, like similar to females when they have menopause, they can also have andropause. So like that. So it's varied symptoms can occur. So very common problems are what we deal with in urology. Right from stones to urinary problems to kidney failure, transplant, as well as cancers like prostate cancer, kidney cancer, and all these things.
Understood. So you were also mentioning about the awareness gap that is present earlier in our discussions, right?
Yeah.
So, I mean, these are all the factors that you mentioned are all kind of not openly discussed, and there is a lot of timidness within the people out there to openly discuss about their issues and come to the right kind of people. So, can you please highlight, like, in the last 5 to 10 years, what has been the situation in men's health care, at least in India, and how do you think that has changed over a course of time?
So andrology as a field, without awareness, it's very difficult to for the patients to understand where to seek help for andrological issues, because there are a lot of advertisement, if you have seen also, that we could cure sexual dysfunction, erectile dysfunction, and they might land up with quacks or very MBBS doctors who might not be able to treat the problem per se. And what happens is, after all the treatments, they shell out a lot of money, as well as after that they are not yet satisfied with the treatment, or the treatment doesn't work, and they end up very irritable, and they become very depressed because of that. So so sexual problems are a problem that has huge psychological impact. So the man will become depressed, and his entire self-confidence will come down in his personal life, indirectly will affect his work life as well. So that is why it is very important that initially itself the patients come directly to an andrologist rather than go to general specialties or other things. So when how can you do this? The first question came to me was, if I started an andrology practice, how will the patients know that this is the right place to go?
Approach.
So that is where the awareness thing comes.
Okay.
So patient has to be aware, or the public has to be aware, that there is some specialty called andrology that deals with male sexual issues, male infertility, prostate problems, and all those things, whichever, all the diseases that affect men. So how? So the first thought was, how is it possible that I can create awareness in the public? So that is when the social media boom was there. Post-COVID, the boom was huge. So that gave a good platform for creating awareness. So I started doing videos initially in YouTube, dealing about general andrological issues and also general urological issues. And then that slowly gained momentum, because I did it in the regional language of Tamil.
Okay.
So because it is far more so the reach would be better if it is in the regional language rather than in English. because the connect won't be there if you do it in English. So when I did it in Tamil, a lot of people saw the videos, got aware, and then directly approached me, and very grateful for the videos, because they could understand before they came that what is the issue that could be and what should we expect from the doctor. So that is very important. So when a patient comes with a well-informed decision when he comes to meet a doctor, he is more able to consider the options when we tell them. So because of the awareness. So that is how it started. And then once after a year, there was a huge response. A lot of patients started consulting me through the social media, and I slowly switched. I also included other social media like LinkedIn and Instagram as well. So now at least 25% to 30% of the patients do approach me after getting aware by these videos. So that is a good number. So that means the awareness makes a difference in India. Yeah.
Absolutely. So you said many patients first consult general physicians when they have certain kind of issues, because they don't know what is the reason for the issues that they are facing, right? When that happens, and if that general physician doesn't know what the issue was, and he doesn't direct the patients to the right kind of doctor like yourself, what kind of challenges will the patient face? I understand that there'll be psychological issues because he's not getting cured. But what do you think should they do when they find in such a soup?
Yeah. So because if the patients are not aware, what happens is that directly what the easiest way to approach healthcare would be the nearest doctor that is there to their home.
Okay.
Irrespective of the specialty, they will just go and have a word with that doctor. So because unless I have gone through medical education right from my MBBS to my MCH, around 15 years of training.
Correct.
So 15 years cannot supplant a 6-year-old training. So it is so the experience is more, and definitely the super specialist would be able to treat diseases in his domain far better. So when a patient, as I told you, when a patient approaches a general medicine doctor, a general physician, he will be treated. Any emergencies they do treat, but fine tuning the treatment would happen only with a super specialist. So for the patient to get the optimal care, it is better to approach a super specialist or a patient or a doctor well experienced in that field. So that he is happy with the treatment. And the thing is, once the patient approaches initially itself the right doctor, the treatment is easy, and he is also happy, gets cured faster. So the entire system is benefited. So even in fact, more these awareness videos are creating awareness among the medical fraternities also. So they also, a lot of doctors have told me, I didn't know that such a field was there and you are practicing it.
Okay.
And they have sent me a lot of patients all around Tamil Nadu to me to consult. So that is how good social media is in creating awareness.
Super. Yeah, that's really nice to understand the impact that you have been creating amongst your own fraternity and the general public as well. So doing all this, right? Being a doctor at PSG, having your own clinic, and also you do an online consultation and also produce videos to put them on social media. How is a day in your life, doctor? How do you balance everything?
So weekdays usually will be very hectic only, especially my OP days. A lot of patients I have to see, around 50 to 60 patients per day I have to see generally. So that becomes hectic.
Wow.
Yeah. So that becomes very hectic. Some days might be less, depending upon the seasonal variation. So maybe in the summer months, a lot of stones. In the winter months, maybe prostate problems.
Okay.
And and also the seasonal variation in the weddings and all those things. The infertility cases might be more in the certain months of the year.
Yeah.
So because of this hectic schedule, I have to balance each day. Otherwise, it is very stressful on the body. So morning it would usually start by 6, and then by 8 I finish my rounds and then do the OPDs. And then the surgeries, if there is emergency, I will do. Otherwise, the OPD will continue. So, and maybe by 5 to 6 I would be done, and then I would be back from PSG, and then the next would be some clinic patients would be there daily, maybe about 8 to 10 patients or something like that. So, and after that I would do my online consultations if there are any, and then maybe have some family time, and then wind up with a short workout.
Okay. Wow.
So it would be
12
my day will end at around 11, 12. My day would end.
That's quite hectic.
So very
But
hectic,
but it's really nice the way you have sandwiched. Like start with PSG consultations, then your own clinic of 8 to 10 8 to 10 patients, following up with family time, and then winding up with a half an hour or 1 hour of exercise. You have strong practice at PSG, 50-60 patients. Why did you start clinical practice again? I mean, just trying to...
No, the thing is, see, basically the demographics, right? Around PSG, maybe around PSG or whoever patients is there, they will come.
Yeah.
Maybe if that sector of the city is not covered, patients might not be able to reach me.
Okay.
Yeah.
Okay.
So it is, a lot of patients have work till 5.
Right.
Especially andrology, they might not be comfortable to leave work and come in the mornings.
Understood.
So evening somewhere they have to consult me, right? It is a logistical issue for the patient. Okay. So evening, if they are not able to consult in the morning, they will come to the clinic in the evening.
Understood. So you're trying to accommodate certain patients who would want.
Okay. Yeah.
So how's you told about your weekday? What are your weekends like? Same Saturday, Sundays?
So Saturdays would be my OPD, usual OPD, because the IT professionals and software people are comfortable with Saturdays because they have holidays.
Sure.
So generally more patients would come on Saturdays. So I usually wind up Saturdays by 5 o'clock.
Okay.
Unless there is some dire emergency, I would be operating. Okay. Otherwise, usually after 5 till the next Sunday night, I would be generally family time and my hobbies and all those things. Yeah.
And when do you...
It would be a relaxing time for me, a rejuvenation from me for the next week's hectic schedule.
Okay. So when do you actually record for the social media?
So social media usually it's usually shorts right now. Reels and shorts are the easiest way to do it these days, because long videos nobody has the time to watch the entire video. Yeah, so it should be short and sweet so that the message gets delivered to the patient properly. So usually it takes 5 to 10 minutes to record maybe 2 videos. So I do it when I finish my clinic. I do it. Maybe I spend 10 to 15 minutes and then finish it off.
On the weekdays itself, nothing for the weekends.
Yeah. Never keep it on weekends. Yeah.
Okay. And I'm capturing your time today, Sunday.
No, it's a pleasure to have and talk with you.
Thank you. I'm really blessed. So, in your service for, 15 years of study, and then how many years you have been practicing?
Yeah, so I've been practicing around 5.5 years right now.
Awesome.
After my super specialty, but the working part starts even after MBBS. Right. Because you're working. There's no like engineering or other fields. We don't sit in classrooms. Right. We study in the wards in the operation theatre. That is how the training works. So you are a practicing doctor soon after you get your MBBS degree.
So let's say after in these 15 years, the 5
around
years,
it will be
15 years you have been working.
Yeah, it will be around 12 years now.
12 years. Okay.
So MBBS I didn't count as this thing. So experience. So it will be 12 to 13 years
of work. Okay, let's say. So during this 12 to 13 years of work, what kind of challenging cases you would have faced, right? Where decision making has been very crucial, and anything from urology or andrology practices, a couple of cases which were very challenging for you.
No, usually andrology is very challenging because the patients come with a severe psychological impact. So if the patient is not able to have sexual intercourse because of erectile dysfunction or any other issues, he will be naturally depressed when they come. They expect results when they come. So, and also the entire family would be in a spot of bother because of this. So it is the way of life in India. So it is stressing for the patient also when they come with expectation to us. We also are under pressure to deliver the results that they expect. And also male infertility is even more difficult because a lot of patients have that family burden. So they would be pestered by the family members that they don't have kids still and all those things. So when the time period of conceiving increases and maybe they say 8 to 10 years they are married, still don't have children, they would be under severe psychological stress. So that is where the andrology is like that. So we have to also to consider the emotional and psychological burden of the patients and then treat them accordingly. So every patient is a different case and also a different challenge. So it is very, very challenging, and also each day we learn new things, right? And irrespective of I have completed everything, the topmost education, everything, medical education. Each day we learn new things, because the medical fraternity, in the sense, we have to revise daily. Every day each new invention is being created. So I want to be in the top. So whatever is new is there, I want to introduce it into my patients so that they can avail whatever latest advancements are there.
Understood. Amazing. I really like your dedication there, doctor. So when you're dealing with such sensitive health issues, right, where family, emotions and personal psychology is all involved, how do you approach it? Like, what would be your personal mindset?
So mindset is empathetic. You should the first thought think is the patient should get cured of the problem. So that is the first thought. Somehow, whatever is possible in my means, I should do to relieve the patient of the distress. So the thing is, always in my mind, whenever I take andrology patients, the thing is, I understand the stress which they come to me. So first step would be understanding what they're going through. So it should be a detailed history of whatever is there. So, and nowadays patients are more open to discuss, not like the previous decade. Nowadays they are more open to discuss about all these things. And also, if they are jittery, if they are very not coming to discussion, then we have to make them comfortable and make them understand this is not whatever problem they have created on themselves. This is a disease, so it has to be treated in a proper way to get them a cure. So that is how my mindset would be when I treat patients.
Amazing. So with PAR, you also have the responsibility to be empathetic with them and cure it in the manner.
Yeah, definitely.
That's nice. So
definitely.
So you must have encountered a lot of situations. Let's say there is one particular case. I'm just asking whether you have encountered a case where the patient has approached you after delayed awareness or hesitation, and it has been significantly delayed. but he finally approaches you. And what has been the outcome? Did you ever encounter such a situation?
Yeah. I usually frequently encounter.
Okay.
So there was one patient who had been treated for 5 long years,
Okay.
and male infertility. He couldn't produce semen, and he was very distressed. For 5 years, he was getting treated everywhere. He had spent around a lot of money on it, and he came to me depressed. And somebody had recommended him.
Okay.
Some of my patients had recommended me, and he came. He was skeptical initially.
Yeah.
So I treated him. After maybe 2 weeks or so, he started producing semen. So he was so happy that I should have come before itself. I could have saved a lot of money, and my mind would have been peaceful. He was saying a lot of things. So these things are very common. We see such patients very commonly.
Okay. As you said, the people are opening up a lot more right now, and they're not as hesitant as before. And they are open about their issues, and they are actually talking. That's, I think, really nice. So you were saying that urology is the first field where robotic surgery has been incorporated, right? You have seen a lot of praise in the field over the years. What do you think would be the next 5 years in the Department of Urology or Andrology per se?
Yeah, so in robotics has changed the entire surgical game. In fact,
Okay.
so previously laparoscopy was introduced similarly only, so it gained importance. Now robotics is slowly. A lot of robots are there now. Initially there was only Da Vinci. Now a lot of company robots are there. It has become more economical.
Correct. Okay.
And all the volumes of surgeries have also increased. A lot of insurances are covering the robotics. So as robotics improves, a lot of advances are coming up, like single port robotics instruments, and improving the tactility of robotics, because initially now robots don't have the tactile touch is missing. So they are trying to bring that as well. And also some amount of automation or pattern recognition, recognizing blood vessels, and all those things can come through AI as well.
Yes.
Artificial intelligence also can help. And also in andrology, the artificial intelligence is coming up big, because artificial intelligence in semen analysis, identifying the best sperm, is already there. It is helping us greatly to improve the fertility rates among infertility couples. So a lot of new advances in urology and andrology are coming up. And also I am developing AI models, artificial intelligence models, in my hospital itself, and through studies. And now I've recently going to complete 2 studies, one for stones and another for identifying urinary tract infection using AI models.
Wow, amazing. So when did you start? When did you start getting interest in tech? Hello.
Sorry, in AI, is it?
In technology and AI, yeah. Of course.
Sorry.
My question.
Yeah. So see. I got it. So see, generally urology is very technology dependent field. So, and we have scopes now. Recent advanced flexible scopes are there. Laser is there now. A lot of advancements in laser is there. Thulium recent, and then without technology, urology doesn't work. If urology has to advance, technology also has to advance side by side. And also in artificial intelligence, definitely it is going to be the future. And it is easier to process volumes of data.
Okay.
So it is not possible for a doctor to, you see, if the patient has 13 years or 14 years, 15 years of health records, it is easier for AI to go through all the data, provided it is in the electronic medical records, and then point out. So it might take a few hours for the doctor to go through, and sometimes the doctors cannot go through the entire thing because volumes of data there. So that is where AI comes in. AI and quantum, the computing power is there. So that will help us very much in improving the patient care and improving ourselves as well.
Amazing. That's very interesting, doctor. I mean, you're so open to technology and accepting the digital field. That's really amazing. Now,
Thank you.
there is surgery, there is regular treatment also, right? In your field
Yeah.
of work, what do you think? Like, people can be treated with regular treatments, or do you think it's important that they go into a surgery all the time? Most of the cases that you have dealt with, how do you pursue them per se?
So it is usually 50%, 50-50, maybe half-half. So initially mild symptoms, common problems, generally you can treat with the medical therapy.
Okay.
If it is a complicated one, they have complications or they have very severe symptoms or they are require emergencies, then surgeries would be the option. Sometimes the diseases would be surgical diseases rather than medical. You cannot treat in a medical way. Example is cancers. So without the surgery, the cancers cannot be treated. So that is why it is a balance of both medical therapy and mild symptom patients, surgery in required patients. Yeah.
So urology also sees cancer patients? Like
Yeah. Urology is cancer. Yeah. I do, because andrology I have brought into prostate problems as well as prostate cancers also in my domain.
Okay.
Usually andrologists don't bring that into their domain.
Okay.
I have personally felt that prostate is a niche field for men alone. So I do prostate also. So yeah.
That's nice. So for general public, right? What are those issues, men's health issues, that they shouldn't ignore at all?
Yeah. So men's health issues. First thing is, the men's health is a very common health issues that they can face. If you see, the most common andrological issues, erectile dysfunction and sexual dysfunction. So erectile dysfunction, the most important thing that the general public has to know is it is the blockage of the penile blood vessels. That is why he is getting erectile dysfunction. So naturally, when the patient is diabetic or has other cholesterol problems, the blockage in the vessels will lead on to erectile dysfunction. So naturally, the caliber of the heart vessels are similar to the penile vessels. So that is why they can have a heart block as well. So it is the people with a blood vessel problem leading on to erectile dysfunction are at very high risk for heart attacks. So patients have to be very careful. If they have erectile dysfunction, better to approach a doctor and get evaluated. So we have prevented. So 25% of the patients have cardiac ailments with erectile dysfunction. Importantly, is coronary artery diseases. So we have diagnosed a lot of patients on evaluating for erectile dysfunction with coronary artery disease, and they have got treated and they are safe now. So that is more important.
Wow, this kind of analysis I'm listening for the first time, because of course I'm not from the medical field, but nobody has actually come up with this kind of information, that cardiac and urology are interrelated, and there can be a lot more issues than just psychology. That's an important
correct.
Yeah. So what kind of simple lifestyle changes that people or men in general can bring about so that their reproductive health is much less stressful, or they can be free of whatever stress they have?
Yeah, 3 important pillars are there for a proper men's health. So first thing is the weight. So they have avoid obesity is the most important thing. So for that, an optimal diet rich in proteins, vitamins, fibers are very important. So protein intake should be provided they don't have any renal kidney issues. The daily protein intake should be around 1 gram per kilogram body weight. So that has to be maintained. And also a rich diet in fruits, vegetables.
Okay.
Sorry.
60 kgs weight should eat 60 grams of protein.
Yeah, 60 grams. Yeah,
So
yeah.
this is true
Yeah,
even
almost.
for women.
You could reach around 50. 50. You can reach around 50.
Okay.
50 grams at least.
This is true even
So
for women, doctor?
generally Indian, yeah,
Sorry.
yeah, for everyone.
Okay.
Yeah, for everyone. And generally Indian diet is more carb loaded rather than the protein. So you have to be, you can approach a dietitian and then get that things sorted out depending upon your age and your comorbidities. Accordingly, they would give you a diet. So diet is very important. The second pillar is the exercise. Daily consistent exercise, short period, around for half an hour to 45 minutes is the best schedule for it. And the third one is the sleep. So a proper 6 to 7 hours of sleep is very important for the body to rejuvenate and recuperate. So these three things would help in hormonal health for men, reproductive health, as well as general health for men. Yeah.
Got it. Thanks so much, doctor. Now, is there any misconception that is prominent among men health or in general that you think?
Yeah, misconception is, generally in India, it's a taboo, men's health. So they don't approach. Nowadays, this generation are aware and they come. So they think that this sexual problem, I am not sexually active, I have 2 kids, why should I worry about it? That is the most important misconceptions that they have. In the background, their marital life would be affecting so much, they would not know. Their wife might not be so upcoming to tell them that this is not right, you have to get checked. So that ego and this thing should, the taboo should be avoided, and they should come and get themselves evaluated to avoid any future complications. The initial stage itself, if they get treated like any other disease, it is treatable, curable, and they can avoid complications.
Amazing. So there are many young doctors. Maybe they don't have the same kind of knowledge grasping as you have, and they may not know the right direction. So if they want to choose this as the super specialty, urology and andrology, right? What do you suggest to them, and what qualities you think they should develop so that they can be one of the best like yourself? Hello? Yeah, okay.
So urology and andrology in general is a very good field. It's an evergreen field because these diseases are very common, and they always a lot of volume of patients would be there. Actually, the amount of doctors required are even more in urology and andrology because the patients are volume is so huge. So the thing is, basically, like any other field in medicine, requires dedication, requires proper training, and also proper mentorship as well. So that they go through the proper pathway, proper protocol should be followed, and then so that they get optimal results. So that should be, as a doctor, generally in any field. In urology and andrology more so over, you should be also, it is a surgical field only, it also requires some medical therapy. You should be able to balance both. And also you should have a mindset to medically treat also, you should be open, so not only surgeries. So that mindset that has to be there, and also they have to be more open to patients, hearing patients more in andrology, because the history is very important, and also they should be more empathetic and more understanding of patients. And then they should also do more counseling. So the time is very essential in andrology.
So investigative treatment is important in andrology, is what you're saying?
Yeah, investigation, like any other disease, you have to investigate properly. Treatment is also very important, but it is more attached personally with the patient. So the empathy and the more understanding nature of the doctor is more important when you want to become an andrologist. Yeah.
Got it. In your practice, doctor, anytime did you come across,
Mhm.
like you have been explaining how important this particular field is, right? Any patient that has
Mhm.
stayed with you, like because of their conditions or because of their emotional trauma for a long period of time? Of course, you have been treating like 50, 60 patients on a daily
Mhm.
basis. That's a lot of volume, but still, there has been some patient or some case that has stayed with you for whatever reasons. Can you please say, explain that?
Yeah, see, there's no sum. This most of the patients are like that for
Okay.
me.
Okay.
So urology field mostly they are very. We usually advise them regular checkups.
Okay.
So most of the patients are like family
Mm.
because it is like we see them often.
Yeah.
They tell us what is happening in their family and all those things.
Mm-hmm.
So they are more like.
They tell you.
So common regular follow-up patients are usually they stay with us.
Mm.
So like cancers, say for example, they have need a regular follow-up.
Okay.
So
Okay.
yeah, and also in andrology, the sexual dysfunction usually they stay with us for 6 months to 1 year
Mm.
until the treatment is over, like that. So yeah, generally compared to other fields, the follow-up is more in urology and andrology. So yeah,
Okay.
so that is how it is.
Okay, so has there been a moment in your career path, right, where you felt this patient is actually it's an easy disease and you can treat it quickly, but then as you did your diagnosis and did your investigation and all that, you figured that it is a more complex problem than what you had thought. And how did you reveal that, or how did you approach such a situation? Have you come across such vividness before?
Yeah, so that is rare, in fact, in my practice because I totally evaluate the patient properly before I put a scalpel on the patient. Yeah, so before I operate. So yeah, so detailed evaluation, investigation, proper explaining I do. The benefit of experience is that you know which patients would you should expect complications and all those things. So initial days maybe I had faced some issues like that because every
Patient.
doctor goes through experience. Nowadays it is very rare. You know what is going to happen. You explain to the patient properly what is there.
Okay.
If patient has a lot of complications, properly counsel the patient that these and all things can happen. And yes, and the patients are also very open to discussing, and they are also understand that this is that, and also this awareness things on social media clearly helps them also because every time they cannot approach me and then ask discuss keep on discussing. So
Sure.
what help does is they can just switch on YouTube and then just
They
go
can
through the set of things about that surgery again
understand.
if they want to. Yeah.
That's interesting. That's a very nice thing that you have done with the social media. So,
Yeah.
one important message that you would want to leave for the people out there in general about awareness about men's health and what kind of precautions they should take, or what kind of life changing, or any kind of important message that you would want to give to your to the general public out there.
Yeah. So what I would want to tell is andrology or men's health issues are very common.
Okay.
So if you have any such issue, please don't hesitate. If you have some hesitation, kindly log on to your YouTube and look at my channel, The Patient's Doctor, and then you would have a lot of material to see, and then you would know what problem it is, and then you can approach it. It will make you more comfortable to know about the disease and then approach the doctors. You need not be scared. So earlier the better, so that you can avoid complications, and it also easy for us to cure you of the problem. So men's health issues are I want to again say that men's health issues are very common. Kindly don't hesitate, come to your andrologist and get treated so that you can lead a very happy life.
Wow, thank you so much, Doctor. It was very insightful. Thanks for your journey and insights that you shared with us today. Really happy to have you, and really glad that you answered so many of my questions. And trust me, I did not know anything about urology or andrology before I spoke to you. So today it was a revelation for me also. So thank you so much, Doctor, once again. Thanks.
Thank you for hosting me. The pleasure was mine. Hope I have shared some useful
Yes,
information about my field and how I go about it. Yeah.
of course. Yeah. Thank you so much. It was really wonderful having you.
Yeah.
Yeah.
Yeah. Okay.
Okay.
Okay. Bye. Have a nice day. Bye.
You too. Thank you.